It's time to be woke, take off your shades, it helps see through the smoke, cause the wicked hide behind the cloak, and if you stay in the mist, you gon' be soaked, so listen up, cause this hair of the dog, what's real, what ain't, is this the fog or smog, cause there's a difference when you breathe it in, so don't let the corporate media take you for a spin, this that morning show, they put you in the know, so I hope that you ready, cause all we do is go, 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 yeah, come get your info, you gon' be like, whoa. Dog, we bout that, ayy. We in the zone, we out here, yeah.
Good morning, everyone. Welcome to Hair of the Dog. I'm Andy Kennedy. It is Wednesday morning, fine Wednesday morning here in Ontario, Canada. I actually got to leave my house yesterday, go on a little excursion, mask in hand. I went and donated blood, and talk about the pandemic. There used to be a very social event going to give blood. Well, first of all, they can't help but be glad to see you. And then afterwards, your reward is a snack or two and a nice dish of ice cream or a bottle of water or coffee, and sit and relax for 15 minutes, speaking to other people that you've never met before. Kind of a really nice experience. Of course, all of those things now are impossible because it's pandemic. So it's a lot more of a solo act now than it used to be, but such is the times. We've got an excellent show for you today. And that starts with the introduction of my lovely and talented co-host, Miss Carrie Barber. Good morning, Carrie.
Hey, good morning, Annie. I'm so glad that you were able to out and about yourself a little bit. And
even if I came home a little less whole.
Well, thank you for donating blood.
As my Scottish uncle would say, I'm down a pint.
That's exactly right. You got to refill it with the Guinness. That's how it works. So
that's right. One of the great side effects of donating blood is how much of a cheap drunk you are that night.
Exactly. Just rosy cheeked and ready to go.
That's right. I was pissed. How come? I had a beer.
Exactly. Just one. So, well, Thank you for doing that. And hey, happy Cinco de Mayo to everyone else. Remember when we got along with Mexico and we fought the French? Yeah, that's what today is about. So it's not just about your Modelo. We have some history working there. So woot. So there's some big news happening today, and I'm watching this. I expected to see something before we went live so I could share it with you. Nothing. So what I'm talking about is the WTO is meeting starting today and tomorrow. These are the G7 countries. The US is a part of this. And the G7 countries have been pushing the Biden administration to put a suspension on patent rights for the COVID vaccine. So for those of you who either aren't getting global news or aren't aware, there are countries that are literally dying in massive amounts because they don't have the vaccine. So we saw Bill Gates, and hey, shout out to Mrs. Gates, good choice. So we saw Bill Gates arguing for patent protection because he's an asshole and, apparently likes death. So it was not just Bill Gates. It was also, I saw a Washington Post and the New York Times put out op-eds about how we need to protect profits. Well, fuck you guys. People over profits always. And Andy and I talked about earlier how when we side with corporations and keep these patents in place, we are literally killing ourselves because we've known that COVID has this really nice ability to mutate. And even in this country, when you've gotten your vaccines, you're still at risk for getting it. And some people who have been fully vaccinated are ending up in the hospital. Some have died. It's a much smaller amount because of the vaccine, but we're not out of the woods by any stretch. And when you listen to somebody like an asshole like Bill Gates or Bezos, who is putting this out in his paid for newspaper, they're literally trying to kill us here for their profits. So today, the Biden administration has to go before these G7 countries and explain to them either that we are going to suspend the patents or we're not, and why we're assholes and a continuing threat to world peace and harmony. So as this story develops, watch for it. We'll bring it to you on Friday with the full information, but this is huge.
Huge.
Yeah. And so for those of you who are still on the fence, I just have two words for you: polio vaccine. Yeah. So if you think that it was totally cool to withhold the patent rights for COVID, I just want to remind you that we don't have polio because we've made that available to the rest of the world. And oh, by the way, antibiotics, that was a European invention, but we use it heavily here. So yeah, I'm not going to have much sympathy for anyone who is going to be arguing for profits at this point, particularly since the U.S. helped finance through public money. We as a people help finance this, so we should get a say in how this actually goes down. But the story that we have coming up today, oh boy, if you had any doubts about the complicity of politicians in their dark pack donors and the monopoly of insurance company, oh, wait till you hear this story. So I've been working on this for a couple of days because
now before you do, I just wanted to add this one final thing. Okay. You've heard us talk about Bill Gates in the last few shows and the reprehensible views that he's taken and what Carrie's just been talking about. I actually got very excited when I heard that he and his wife are splitting up, because what usually happens is that the guy will start to cut back on his income in order to make his annual salary less, so that he doesn't have his big support payments. So I was excited because I thought that might turn into Bill Gates thinking, okay, maybe we can relax on the patents a little bit, and then he'd make less money.
Yeah. Or somebody teach him how to crochet. Give him a different hobby, because yeah.
And by the way, he's basically self-appointed in terms of the overseer of medical industries in the world, right? He basically he's like the old guy that walks by the kids' baseball game and decides to umpire.
Right, because I have a lot of money, therefore, and I think part of it is that old adage where people are kind of kissing your butt because you got money, so you start to believe your own stench.
Yeah. It's if anybody had any doubts that the world isn't run by the oligarch class, this should be a good indication. Yeah,
well, here's your sign. There's that. So all right, well, let's not keep our guest waiting. I am so excited to have this one on here. But first, and now I'm going to make the guest wait a little bit. If you're just tuning in for the first time, welcome to our show. We are fully interactive and obviously live, so absolutely anything can happen. So bear with us as we go through some technical stuff, but we want you to participate in this discussion. And if you go to our Facebook page or YouTube or any of those places where you're watching this, I have already posted a plethora of links, and I've been doing homework on this here for days, hours and hours invested in this, because I am an investigative journalist, so I have to do my homework. And here we try to bring you credible, impartial information, and those are the links that you're seeing. You're also going to see some graphics and some videos to kind of help tell the story, and all of this is objective. So I always take it from publicly available sources, because number one, I don't want to get sued. Number two, this is information that you as a civically engaged citizen have access to. I am going to talk about one particular document that for some reason politicos in Kansas have decided to withhold from you, which is illegal and should be FOIA-able. So I will get to that one. But yeah, without further ado, Let's bring on Jo Cheray. She is a disability advocate. She ran for office as a Democrat in Kansas. That's hugely brave. So, Jo, welcome this morning. How are you?
Hey, I'm doing great. Good to see you, Carrie and Andy, and hello to the Hair of the Dog audience out there.
Yeah, I first saw you talking about this on Twitter, and I was trying to piece it together because it is a little complex and there's a lot going on. But when you and I first sat down and talked about it, it sounded incredible to me, right? So this is where I started doing my homework. Is this true? And wow. Yeah, so
I wasn't bullshitting.
Not at all. Not at all. And what surprises me is you have been an advocate for so long. You even went before the state legislature to plead the case and advocate for people. But before we get into that, let's back up a little bit. Why the hell do you care about disability rights?
Because my son's disabled. He was born with cerebral palsy. He went into cardiac arrest and lung failure when he was first born. Actually, he went into cardiac arrest and lung failure as he was coming out of the birth canal. And he spent 2 weeks in the NICU at Children's Mercy in Kansas City, Missouri. I keep forgetting it's on the Missouri side of Kansas City. And the doctors diagnosed him with cerebral palsy. And so I have been, for the most part, a single parent taking care of a child with special needs his whole life.
Okay, so you have an intimate knowledge of what it takes, what you have to sacrifice, what you have to give, and so you also have some experience working through social services in your state. So Kansas City has something called CanCare.
CanCare. Okay. Kansas, yes. CanCare is Kansas. Don't know what Missouri has.
Okay. So tell us a little bit about what was going on with that situation and when you reached out for care.
We have our case management services through TARC, which is one of the places that does case management services for people with disabilities here in Topeka. And we finally came off the waiting list for home and community-based supports. And, things were going okay. I mean, we got questionable care attendance. And then we got burnt out.
Let's go into your story a little bit about the questionable care attendants. Who are these people and what happened?
Okay. Well, first we had one guy who decided that he was going to give a medication to my son without consulting me to help my son sleep. And then we had another guy who decided that he was going to be a no-call, no-show one day to go pick Anthony up from school. And we had another guy who decided that he really didn't want to work that hard. And then we had another gal that tried to burn my house down and also be a no-call, no-show. And she ended up going to Wichita, and I had to find out through her cousin 5 days later that she was in Wichita.
So these are people that you entrusted with the life and care of your son. And we can't really downplay this. When you are caring for somebody who is disabled, developmentally disabled, and even physically, you are taking that person's life and care in your hands and committing to the family that you will do no harm. And here you've had a situation where multiple times you've had people seriously drop the ball, and put your son's life in danger. So where are these people coming from? Who's contracting them? Who's in charge of training them? How does this work?
Well, sadly, there is really no training. The bar is so low on this because it's self-directed that they're basically college kids with a pulse. And they, you know, you may have taken care of your aunt's cousin, or, you know, something like that. There is no actual, hey, you have to be a certified nurse's aide for X amount of years, or you have to be a home health aide for a certain amount of X years, or at least a med aide. And you have to have your licenses in good standing and that kind of stuff. There is no requirement for that in the state.
So this could be just somebody off the street. So, all right. So what does compensation look like for these folks?
A paycheck of $9, at least $9.30 an hour. That's it.
Okay. So $9.30. It's obviously not a livable wage, even in rural Kansas. So we're expecting, like you said, somebody with a pulse to just show up, take care of the disabled. So to me, this looks like the value that we are placing not only on the program that the state is offering, but the people that are supposed to be served. This is the value that we're placing on them and the participants, which is nothing. So die quietly is how I view this. And I just want people to know, I full disclosure, I am disabled. I have Medicare. So I'm perhaps going to view this a little bit different than the casual viewer. But this is, to me, just egregious all around. So you have gone to the state and you have petitioned, and in fact, I included a link to your statement that you made to these representatives about the quality of care and how you would fix this, right? So do you want to talk about that just a little bit, that experience?
Well, I will say it was very dehumanizing to go before the committee, not once, but twice, to plead our case. The first time I went before the committee, I tried to have a conversation with our then the governor, who is then our senator, and a friend of mine had tried to coordinate a meeting with her before she took her seat at the committee, within the committee bench or desks or whatever they have there. And, he looked at her and he said, Lori, Joe would like to speak with you for a few minutes. Can you please go talk to her? And she took one look at me and then she just shuffled on her way. And so I never did get to talk to her personally about my situation. And then I went before the Oversight Committee again. It's called the CanCare Oversight Committee. And I went before them again, and I wanted to talk to the AmeriGroup guy. And he told me, he goes, I can't talk to you because you have an open appeal. And he was the governmental relations guy for AmeriGroup at the time. Wow. And I messaged then Senator Laura Kelly, and I said, I'm the Oversight Committee hoping that you could help me out. And you didn't even ask me any questions. I said, I'm one of your constituents. And all she could ask me was, what was the guy's name that told you that, and I messaged her on Facebook on this. And so I didn't get any help from anybody on that committee, none. And then, I started to do some digging, and I thought, well, there's got to be a reason why they're not really helping people like me. And I looked at all of their campaign finance reports, and I realized, well, there's probably a good reason why people like me aren't getting the help that we need, because as long as the insurance companies are making a profit, the insurance companies can continue to funnel money to these people's campaigns. And so the one time I went before the CanCare Oversight Committee, I exposed everybody that was on that committee to God and everybody that day. And I rattled off everybody who was taking money from the insurance companies that they were charged with oversight on and who they were taking money from. And you could hear a pin drop in that room. And people, I could hear people muttering behind me like, oh my God, really? And the chair at the time, Vicki Schmidt, when I got to her, all she could do was give me this deer in the headlights smile. And later I went to the bathroom and she was in the restroom with me. This is really funny. I have to get this in here. She took one look at me as we were coming out of the stalls at the same time, and she made a beeline for the restroom door. She couldn't get away from me fast enough. It was funny.
Oh, well, okay. So here you are, you're calling them out, and Andy, you bring this up often enough that it bears repeating. These are the donors, the donor class. And I posted a link to The Intercept. This is something that Lee Feng published April of 2021. This is, and here's where it's relevant. It's CVS Healthcare Chief Executive Officer Karen Lynch. She co-signed a couple letters to state governors, Kansas included, where they had been donating to a dark PAC to dissuade legislatures about expanding Medicaid and, oh, by the way, Medicare for all. So CVS, Aetna, the reason why it's relevant to your particular story is in Kansas City, the state of Kansas, there were 3 providers of Medicaid, the CanCare in the program, and they also own some of the smaller subsidiary providers. There are now 2. One left Kansas, and I was able to go through the governor's budget and find a $900,000 payment to the company that exited Kansas. And that leaves just 2, and Aetna is one of them. Aetna, which surprising to me was the legislature is well aware of the problems with Aetna. You can find over a dozen articles and even the Kansas legislature itself where they have censured Aetna because they are not expanding their networks. Doctors and hospitals and providers are not able to sign on to agreements. So what Aetna has essentially done is pushed out competition and then made sure they did not expand their network. So they were selling insurance to the state through Medicaid, through Medicare, all of these other programs, while not actually providing a method to get care. Just so everyone's understands this, an insurance policy is not a guarantee of care. It's just an insurance legal document. If you cannot get access to someone who is on that network, you get no care. And so this was the chief donor to many of the people on that committee. Is that correct?
Yes. Aetna gives quite a bit of money to all of the people that sit on these committees.
Okay, so
Cheray, do you mind if I ask a quick question?
Please, Andy, jump in.
Just because my origin and trying to understand the highly convoluted American system. Okay, so from what I understand is that because Joe's son is disabled, he qualifies for Medicare.
Yes,
after
Medicaid.
Well, both of them actually. The way it works in the United States is once you get approved as a disability status, you have a 2-year waiting period where they wait to see if you die quietly. And then after that 2 years, then you get access to Medicare Parts A and B. But the benefits that Kansas was offering to Joe's son were under the Medicaid program.
Of course.
Right.
So basically you have a certainly pseudo paid for medical coverage because of the disability, but the state that is providing that to maximize profits and to minimize cost hires students at a very small wage to actually provide the services.
Exactly.
Okay. All right. I'm up to speed now. Just wanted to ask. Thank you.
You encapsulated it perfectly.
All right.
Yeah, and there's no logic to it. So Andy, let's help our viewers out a little bit. This is the first one, Medicare coverage. So yeah, we have two separate programs, Medicaid and Medicare, and sometimes those streams cross. But I wanted to make sure people understood under Medicare Parts A, this is the inherited part from when the Medicare first came out and everybody cried socialism. This covered your in-hospital stays and very limited in-hospital stays. And then we added Part B, which is outside of the hospital. This is palliative care and some of these other things. So you get Parts A and Part B, and they take it out of your disability benefits to pay for this. Here are some of the things that are covered. Medicare leans heavily into the skilled nursing portion of it. So you see that they allow for part-time skilled nursing. This is a qualified nurse, a physical therapist. This is qualified, certified, occupational therapy, qualified, certified, speech language pathology, medical social services. This is part of, if you need Meals on Wheels or other coordination, they do that, but that is also a certified person. What they don't pay for is just the meals delivered to your home, 24-hour care, or if you're in a situation like Joe's household where you need somebody to come in and just do some basic things, custodial care is what it's called. Since Medicare doesn't cover that, that's where it falls to a program like Medicaid. And for those who still didn't get it, Medicaid is not managed by the state, it's managed by a private for-profit company, right? So same companies, and this is
shocked look.
Yeah. So this is really where we start to get into a discussion about quality of care and where that cost is going. So Andy, real quick, this is the second graphic, Medicare wage rates. So when Joe was telling me about the Medicare rate, and she said 9 something an hour for these, whoever these people are, well-meaning or otherwise. So I went out and pulled the Medicare wage rates, and these are published rates. And I'm not gonna lie, it's really hard to read, and you have to know the wage rates you're looking at. So here's what I found. The published rates for a home health aide, Medicare will pay $69.11 per hour. Medical social services is $244. Occupational therapy is $167. Physical therapy is $166. Skilled nursing is $152. Speech language pathology is $181. So these are the reimbursement rates for a skilled professional, and to allow that company that is managing schedules a little bit of profit. They're restricted at about 20% profit. So that's where these numbers come from. So look again at home health aid, $69.11. Medicaid was paying these people $9. And the Medicaid rate is about the same as Medicare. So my first question is, why is there such a wide discrepancy between what we're willing to pay someone who has a life and death role in a disabled person's existence and this buffer that the Fed is giving to the state and the private for-profit company? There's
I can explain in one word.
Yeah.
Read.
Cha-ching.
Yeah, I think you're both right. You're
Agreed.
both. So, Joe, if you don't mind, indulge me just a little bit, because one of the other folks that I was really interested in is so here you are, a mom, you have no power, you have no influence, you did everything that you could do, everything that we tell you to be civically engaged, and you got nowhere. So I went out and looked at who else is raising the alarm, and it's across the board. This is not the first time the Kansas legislature, this is not the first time the governor has heard these problems. And one of them that I thought was really poignant was a gentleman, the executive director of InterHab, which is a disability coordination kind of entity, a non-for-profit. A gentleman by the name of Matt Fletcher appeared before the Social Services Committee. And some of the things that he had to say, I thought were very telling and extraordinarily interesting. So if you don't mind, let's show this clip. It's pretty short.
Mr. Chair, thank you for the opportunity to address the committee today and to discuss the ongoing challenges that the IDD service system faces here in the state of Kansas. And the challenges that are faced by our system are really due to two decades plus now of chronic underfunding for community-based services that support Kansans with intellectual and developmental disabilities. And there are two symptoms of that chronic underfunding which really have plagued lawmakers for some time. The first is an ongoing erosion of service capacity, the ability to provide support to those Kansans with IDD who are already in the system, already receiving service, but the infrastructure to provide those services is eroding, and that's due to the underfunding. The other primary symptom, in addition to that, is the state's waiting list of persons with IDD, which now totals more than 4,000 adults and children. And that waiting list has been allowed to grow since the late 90s. That was the last time that the state of Kansas had no waiting list for this population. And it's been allowed to grow to a number now it's very daunting. And I believe that there is no way that you could just simply pull out a checkbook and solve that problem at this point. It's just simply too large. So the members of InterHab have felt for some time that a strategic approach is really needed to creating a roadmap for resolution and elimination of the waiting list. And we are very hopeful that the legislature will take steps to establish some type of a committee process or a study process whereby you can really dig into the issues surrounding the waiting list and develop that roadmap forward. It's really needed. It's never been done. But going back to the first symptom that I pointed out, the erosion of service capacity, service capacity for the community IDD system is really about the ability to recruit and retain a qualified direct care workforce. They're called direct support professionals, that's their title. And it's increasingly difficult for service providers to be able to recruit these individuals to perform this service. The work of a direct support professional is incredibly difficult, taxing work. It's often done without any direct supervision. It's often done with multiple individuals that person has responsibility for, all on their own. And it may include things such as toileting, bathing, feeding, or delivering medications to that individual. Wages for those direct support professionals average around $8 or $9 an hour in the state of Kansas right now. It's just simply not competitive, even with big box retail stores and fast food restaurants. And so we need to do something to help the providers to be able to recruit and retain.
We're back, Gary.
Yeah, so this was, again, that was Matt Fletcher, who is the executive director of InterHab, somebody who has an organization with deep ties into how the legislature operates, all of these various committees. So for those of you just tuning in, we are talking to Jo Cheray. She's a single mom who has a disabled son and has been an outspoken advocate for disability rights. So Jo, let me ask you a question here. So you've got Matt Fletcher pleading the case for this backlog in the developmental delay services. What was the governor's budget like? I know that Governor Kelly's budget just came out. So did any of the legislature heed somebody like Matt Fletcher, his pleas?
There was no money given to the wait list at all.
Zero?
No money zero was given to the wait list. InterHab got money and the traumatic brain injury waiver got money, but there was no money that went to the IDD waiver wait list or IDD employment service agencies. So essentially the IDD waiver got pretty much totally ignored.
So to me, when you say $0 on a budget line item, that means the program is effectively being canceled without canceling it.
Yeah, pretty much. It's going to remain chronically underfunded for I don't know how many more years.
Okay, so how many families are we talking about?
Close to 4,000 Kansans on this wait list that is at least 8 years long.
Okay, so 8 years long, 4,000 Kansans. So when we talk about productivity and the ability to work, this all translates exponentially into the local economies, not just the families themselves, but the local economies and the work that they are able to produce and their commitment to their own employers. And I'm confused at why Kansas would do this. Do you have any insight into the budget or what's going on?
I wished I knew the answer to that, Carrie, because I'm just as confused as you are, as you probably have been looking into this story. Again, this is a fight that I've been fighting for 3 or 4 years now, and I just can't understand why they're choosing to ignore this. I mean, that is exactly what they're doing. When you look at the budget, you're ignoring this. There is no whitewashing it or making it try to look pretty or downplaying it or any other word you want to use. It's being ignored, and which is really sad. I sent an extensive email to the senator that is in the seat that I ran for, and she was actually shocked that this program has been this poorly mismanaged. She had no idea coming into this seat that it was this bad. And so, she asked me, so how do we fix this? And I told her, I said, well, one of the things we need to do is we need to fix the care attendant situation. If we were hiring quality care attendants, then we wouldn't have the situation that my family has faced, for one. And, it's so complex, this situation and this waiver, that it needs fixed. But because both sides of the aisle are choosing to ignore it, my hands are tied. And so, and we need a tsunami.
Yeah, and I think that's exactly right. So in my search and investigation, I did find a couple pieces that I thought were interesting. And just for full disclosure, I did reach out to Will Lawrence, who is the chief of staff for the governor's office. I reached out to Representative Donahoe, and he has a piece of legislation I thought was pretty interesting. I'll talk about in just a moment. I reached out to Senator O'Shea. I haven't gotten any return phone calls, nor have I gotten any of my emails returned. So I did try to reach out to them to get their explanation on it. But one thing I did find that was interesting to me is on February 8th, there was a meeting of the House Social Services Budget Committee. And one of the line items in the minutes was Representative Donahoe introduced a bill, this is 21 RS 1136, requesting a transfer of $100 million from the Department of Education State Foundation aid, which was already fully funded, to the IDD and DD waiver CanCare non-caseload account. So here is a Republican representative who is at least making an attempt to do something, but the minutes and the notation of the meeting don't say whether this was tabled or whether it was defeated or whether it was supported whatsoever. So I did reach out to the representative's office by phone and by email, didn't get a response. The other thing that I found that I think was startling to me was they pretty much ignored and downplayed the governor's budget for 2021 in favor of forward-looking plans for 2022, where it looks like the governor and the legislature is pushing for Medicaid expansion under ACA. This I thought was very telling because if you recall during the presidential election, you had Senator Warren and a bunch of others pushing for just this kind of expansion of Medicaid. But yet again, insurance and access to care are two different things. And Senator Warren herself went after Aetna because Aetna was not going to offer ACA plans in but 4 states. As of today, they now expand to 8 states. There are 50 states in the country. Aetna is not in all of them. And yet they are in Kansas and not doing what they're supposed to be doing because, again, the governor and the legislature has held them to account since 2018, 2019, 2020 on this remediation plan that I was not able to get access to, nor were other reporters who asked for it. For some reason, they are not releasing this remediation report from Aetna, even though it should be publicly available and available on a FOIA request. That is a Freedom of Information request. So I'm calling on the governor of Kansas to make that report knowable, especially if you're talking about putting more of Kansas dollars into a private for-profit company that manages your Medicaid for families like Joe's. Just makes sense.
Well, we can't have anything that makes sense in Kansas. Come on.
Well, and why on a basic level do you hide things, right?
Yeah, it's just like the little kid. Don't look at my room. My room's fine. I cleaned it. I swear. Yeah. So Joe, let me ask you a question because we here we're a progressive network. We're advocates for Medicare for all. I am personally, I've said it before. In the rest of the world, I'm considered a conservative because I lean towards conservative ideas when it comes to saving money, being fiscally responsible. So I am an advocate of Medicare for all, particularly in a situation as we see in Kansas, where you have so much money being hemorrhaged to a for-profit company that isn't delivering time and time again, that is actually costing money. And on the flip side, as you said, it's a bipartisan issue where you have Republicans and Democrats sitting in the House and the Senate and the governor's office with their insurance paid for by taxpayers in your state. Whereas a program like Medicare for All would level all of that. Everybody gets the same coverage and you disperse the burden of cost across the entire nation. And oh, by the way, a family like yours would finally get the care that you are searching for. Any thoughts on that particular program?
Well, again, that would make sense. And it would take the insurance companies out of the equation, and it would not allow candidates that are running for office to have access to a pool of money to continue to fund their campaigns. Is the only thing I can think of that keeps them beholden to this private insurance companies running the state Medicaid system. Because, under Brownback, when Brownback decided to privatize CanCare, we were all, oh my God, we can't do this. It's fine just the way it is. And then he decided to put the IDD waiver into the private system. And, we all decried this and everything else. And then we got a Democratic governor. And I was thinking, okay, great. Now we're going to deprivatize CanCare, because that's what the Democrats were so staunchly, opposing when Brownback was in office. And so far, there's been no appetite to remove the privatization of CanCare out of the state Medicaid system. But why not? Why remove something that you're benefiting from when it comes time for your campaign season and running for re-election or running for election period?
Right. So
I mean, that's the only thing I can think of.
It makes sense. So Andy, this is the last graphic, and I want to drive this point home when it comes to Aetna in particular, in a state. So it's not like this should be a surprise, right? Where you have advocates like Joe, and then leaders of non-for-profit groups, advocacy groups. But here it is again, where state officials are well aware of the problems with the for-profit insurance company. And here's just some general statistics. I mean, there are pages and pages of articles about the problems with Aetna in Kansas. So Aetna right now today provides care for around 100,000 Kansas under the CanCare program. That's the privatized Medicaid. This is again a for-profit company. And the errors alone that were discovered kicked 42 people off Medicaid. Now that sounds like a small number, but again, let's go back to the exponential impact of doing that to a family. These are workers, these are families, these are community members. It translates locally, right? And then children with disabilities are currently covered by Medicaid, and in many cases, their caregivers are not, right? So remember, we had the federal CHIP program. That's gone, by the way. Did anyone notice that that is no longer covered by the federal government and mandates? So a state like Kansas, states' rights, they get to decide who gets covered and at what level. So you have some children who are covered by this Medicaid program, but their family members are not. In particular, these are family members who have to stay home to care for them because there's a lack of support, community resources. So these people are not getting paid, they are not insured, and they are working to try and make sure their families and their communities are fine, yet the state itself is failing them. So, Andy, I couldn't help but think of the interview we did with Dr. Kaboub on federal jobs guarantee, which would address that particular issue as well.
Oh, right? Absolutely. Absolutely. Right. But we're talking about, something that needs a human or moral solution to it. But the only solution that you have is a capitalist one, right? And if that means that we've talked about this so many times, that if it's going to cost somebody in the oligarch class some money, then it's not going to happen, right?
And that's the unfortunate truth. So, Joe, I just have to say, shame on you for not having $200,000-$300,000 to donate to your local politicians so that you can get an audience, right?
Yeah.
So
you're right. You could write that check, but
that would actually be kind of fun. I think that's illegal, but yeah, so don't do it. So Joe,
no, I won't do that.
What is next? Will you keep us updated on the story? Because I know this is still developing. This is still, an everyday thing for you. This is part of your daily life. So what's next for you, and how do we keep in touch with you?
I'm going to continue to push this every day. Like you said, this is a 24/7 thing for me. If you want to reach out to me, anybody that's watching this today wants to reach out to me for further comment or for a story on your own channel or news program, I am an open book. You can reach me on Twitter at WildHeartForever. I believe Carrie and Andy will have my links where you can reach me underneath in the channel description. So feel free to reach out to me. I am always available. I'm very active on Twitter. Carrie and Andy can attest to that. I tweet quite a bit. I don't have very many followers. I only have like 3,900 followers, but I am very prolific on Twitter. So, but yeah, I need help continuing to keep this story out in front of as many eyeballs as possible, because we need to keep putting the pressure on the state to do something about this. And the fact that it's getting ignored or continuing to get brushed under the rug, it's unconscionable. It really is. And like I was telling Carrie, I'm not Carrie, I was telling Senator O'Shea, I said, Kansas's census came back over the weekend. Our population is 2.9 million. You put that $4,000 Kansans under that number, that's a significant chunk of Kansans that are waiting for services under this waiver program.
Did she respond?
Well, all she asked me was, so how do you propose we fix this problem? And I gave that. That's what I was, referring to earlier when I told your audience that I told her exactly how we need to fix the problem. And so I haven't checked my emails yet on that, but I'm kind of curious to see what she says when I go look at my email here in a little bit.
Well, I can tell you she didn't respond to me. So hopefully she responded to you.
I can tell you how to fix it, but you're not going to like
it. No.
Right. And I just want to drive this point home for those who are watching this thinking, oh, well, that's Kansas. No, it's your state too. And here is what I would invite you to do. Your state budget released by your governor, whenever, is publicly available. Go in and look at the line item that governs how much is dedicated to your state and your local legislature for their benefit payment. You are paying for that out of your property taxes, and it has been proven time and time again that a program like Medicare for All would drop your property taxes anywhere from 40 to 60% overnight, because it reduces the cost of care for everybody. So instead of a us versus them situation where you have the haves and the have-nots, we all look out for each other. So I'm going to forward some information on to your lovely governor. Hopefully she'll see it. It's similar to the report that I wrote years ago for West Virginia and Virginia, who had a balanced budget requirement. Medicare for All would not only reduce their costs significantly, but get them in that balanced budget like that. So thank you so much, Joe, for your work on behalf of disabled, on your family, your community. This is so vital, so necessary. And just, I chuckle every time that I hear somebody who is incredulous about the legality of paying a disabled person like $3.25 an hour. That is slave labor. And oh, by the way, if I pissed off a politician or someone else, if I was able to be paid a livable wage, probably wouldn't be doing this work. So there's your incentive.
May I be so bold as to say that if you're going to use the bootstraps argument, you can stick them up your butt.
That's exactly right.
Yeah. I have no bootstraps. My bootstraps are still in the shop somewhere.
Yeah. Yeah. So thank you again, Joe. We really appreciate all your time. And we would love to have you back, hopefully with a positive update where you were able to get through to some of these politicians and really help them to see that they need to put people first over the profits of a private insurance company. So thank you.
Well, just keep following me on Twitter. I will keep tweeting about this until I get results. So
excellent.
All I can do.
Kudos to you, Joe, because you've taken a situation in your own life that most people would think is fairly tragic with a family member, but you've been able to take it and put positive energy towards trying to make a more just change in our society, and so that's a really big deal. So on behalf of our viewers, I'd like to say thank you for that.
Thank you.
All right, so that's all we have time for today. I really appreciate everyone who's tuning in. If you watch this and you felt compelled to maybe make a change, make a difference, start by sharing this broadcast, because the more people who understand what's going on, step out of their own comfort zone and really start to piece these things together, the more that we can see that we need community and we need to be relying on each other. And that means taking care of each other. So please share this information. And if you have questions or you want to dispute anything that was shared here, put it on our network. We will totally have that conversation, and we'll piece through any questions that you have. So thank you so much for tuning in. Andy, why don't you take us out?
I will, and I'll just say to close that we consistently advocate for progressive policies and a more just society that improves the lives of all people in the world. You know, my country, United States, wherever that is, because a more moral, more just society will no longer have to have people like Joe fighting the corruption and the greed, where she can concentrate on, you know, family and the things that are important and not have to struggle. And, you know, the same idea and concept for people that can't get clean drinking water in Michigan or around the country or around the world that constantly are battling just to survive, especially now during a pandemic. That's a really big deal, and that's what we strive for here. And on that note, I just like to wish everybody a fantastic Wednesday. Enjoy the rest of your day, and we will see you bright and early on Friday morning. Take care, everybody.
We bout that, ayy. We in the zone, we out here, yeah. Spitting the facts, how it's supposed to be. Hair of the dog, we keeping it